Hello everyone, my name is Mohammad Asif Alam. Today we are going to learn a very important drugs used in ICU casualty. The name of drug is Clopidogrel. The composition of Clopidogrel is Clopidogrel. This is the life-saving medicines used in cardiology, neurology, and vascular medicines. The Clopidogrel is the group of thiopyridine group of antiplatelet medicines. Its main action is on it blocks the P2Y12 receptor on platelet and it prevents clot formation and it prevents platelet aggregation. What is the indication of Clopidogrel? The indication of Clopidogrel in a cardiology when a patient having a SCS, NSTMI या STEMI या पोस्ट PTCA पेशेंट या पोस्ट DEB पेशेंट या पोस्ट थ्रोम्बोलाइसिस पेशेंट या पोस्ट CABG पेशेंट. In a neurology, a patient having a stroke, TIA, and in vascular medicines, peripheral artery disease, yeah, carotid disease. What is the dose of Clopidogrel? The dose of Clopidogrel is 75 mg once a day. In a loading dose, 300 to 600 mg given when a plan for PCI, yeah, patient have a massive MI. How to give Clopidogrel in ICU or casualty? The route of Clopidogrel is only oral and check the patient's name and indication and doses. And secondly, give a whole tablet with the water and do not cross the medicine. Do not cross the medicines unless cardiologist instruct. And can you give medicines with the food or without a food? And what is the criteria to give a loading dose to the patients? And firstly, explain about this to the patients and the relative. Secondly, give the whole medicine with 100 ml to 200 ml of water. Secondly, documents clearly. Before administration of Clopidogrel, you have to check first bleeding. Bleeding, melena, hematuria, hemesis, suspected intracranial hemorrhage, and fresh bleeding. If they are, don't give and inform the doctor. Secondly, check the lab value. Platelet must be above to 1 lakh and check the HB and check BTCT, PTINR, APTT if patients already on anticoagulant. Thirdly, drug interaction. Avoid omeprazole or esomeprazole, NSAID, warfarin. And fourth one is pending procedure. Avoid when plan for CABG, plan for PPM, plan for any invasive surgery, then stop the medicine and inform the doctor. After giving Clopidogrel, check vitals of the patient for every 15 minutes for 1 hour, every 30 minutes for next hour, and every hour for 4 hours. Second one is the bleeding. Urine color, stool color, gum bleed, yeah, IB site bleed. And third one is the neurological examination in which check a headache, confusion, yeah, new weakness arised. The things nursing staff must avoid. Don't give medicines if active bleeding are there. Don't avoid a double dosing. Do not cross the medicine without doctor's order. And don't stop the medicine with own. And check the neurological status. If a patient having a headache, don't give the medicines and maybe intracranial hemorrhage, yeah, bleed are there. And don't give with omeprazole and esomeprazole medicine. Don't give with NSAID medicines. What is the serious side effect of Clopidogrel? The serious side effect of Clopidogrel is the severe bleeding, intracranial hemorrhage, and GI bleeding, and site bleeding we can say.